May 13th, Human Services Committee to order. Looking for a motion. Pardon? No? Motion to approve the agenda.
Move. Support.
We have a motion by Commissioner Placzek, supported by Commissioner Rice. All in favor? All right, we have the agenda set. Public comments. Is there anyone that would like to make a comment to the board? Public comment? All right, thank you. Next up, we have the minutes. Presented in your packet are the minutes of the April 8th Human Services Committee meeting.
Move to approve the April minutes.
We have a motion made by Commissioner Rice, supported by Commissioner Leitner. All in favor of accepting those minutes for the report? Aye. All opposed? Thank you. Next up, we have a Lifeways monthly report. Mary Beth? Good morning.
Hey, good morning. Okay, you should have gotten in your packet a report from Lifeways. Let me give you some updates as it regards first to the local funding. Currently, we have been having meetings, and we have a meeting actually today scheduled with your facilities, individual, and Lifeways to kind of talk about some next steps for negotiations in regards to functions and which things the county will be able to provide for us and which things we will need to be able to maintain in-house. So we're doing that today. We've also been working with the Hillsdale County regarding negotiations for facility support as well. The one strategic plan initiative that we had in regards to generating some local funding related to our provider contracts currently is being evaluated through legal counsel to ensure the legality of the arrangement, so that's where we're at related to that issue. Tenants, we continue to renegotiate the tenant leases as they come up available and have been able to increase our tenant contracts to generate additional local revenue. We also did receive a notice of intent for a long-term arrangement for a contract for the vacant space there at Lifeways. It is a contract that does not go into place, however, for another year, so we're in the process of negotiating for that contract. In the meantime, we are looking at our options related to a short-term contract. We have received two notice of intents related to a contract kind of similar to last year. We went into a Halloween type of arrangement where it was short-term, but it did allow us to generate revenue for that space, so we're in the negotiations with that right now. The other thing that we're continuing to do is related to having discussions with JTE about offsets related to local funding. So we're still working with the Jackson Transportation around that issue. We're able to have our tax portion for that piece of property changed to be tax exempt, because we did utilize it this past year for storage as well as for the Everything Under the Sun sale that you might recall that we did late last year. So that did to have some savings related to local revenue. The other thing that I wanted to bring you up to speed on too is related to some things that are happening at the state. As you know, we did submit for the application for participation, and we are in the process. We did finalize our bylaws and are in the process of selecting the regional board member appointments. There'll be 2 appointments from each of the CMHs in our region, and they will be appointed from the CMH board. And we are in the process this month of approving both the resolution for the acceptance of the bylaws for the regional entity as well as the appointments from our board to this regional entity. We have agreed on a name for that region, and it's going to be the Mid-State Network Health Network. So that's the new name for that region. We are also in the process of continuing to advocate at the state level in regards to 2 of the state commitments in regards to going in the direction of regionalization from the PIHPs from 18 to 10 was to ensure that there would not be harm created as a part of the regionalization. Part of the harm that will be caused as a part of the regionalization is related to funding. Because of the fact that the funding is disproportionate across the region for each of the CMHs, many of the CMHs, not Lifeways being one of them, because we're one of the poorest funded CMHs in the region, will receive a significant reduction in their funding by going in this direction. And the state had committed by doing this that there would not be harm. So we have been doing a lot of work with our representatives to advocate for appropriation language to change to allow for equalization in the region. And I'm happy to say for the Senate did propose language in the DCH appropriation submission that they do have equity within the region. So we're still continuing to do advocacy on the House side, but wanted you to be aware of that as well. The other thing that's happening is related to Medicaid expansion. You might have heard that it was just recently released related to the House, the Republican House submitted some language related to Medicaid expansion, and they're proposing, they actually wanted to revise and actually call it Healthy Michigan Plan instead of Medicaid expansion. And what this is related to is the fact that there is concern on the Republican side about Medicaid expansion and the sustainability of Medicaid expansion beyond the 3 years that the federal government has committed to funding it at 100%. Some of the elements of the key bill is in setting up a health savings account for each of the individuals that are eligible under the Medicaid expansion to require that they actually contribute about a 5% cost for co-pays and deductibles and that type of thing. There's also going to be a requirement not for current Medicaid recipients, for those that fall under the Medicaid expansion, that there would be a limit of 4 years eligibility on Medicaid expansion. And that the minute that the state no longer funded it at 100%, the state would no longer participate in the Medicaid expansion. So those were some of the elements as far as it relates to the House's proposal related to implementing a Medicaid expansion. As you know, in our community, many of the individuals that we serve that come to our doors that fall under our general fund are people that would qualify for Medicaid expansion. And we also see that within our communities for individuals with at the hospital who are uncompensated care. So Medicaid expansion is a positive thing that we've been advocating for a long time, and this is kind of a compromise, and hoping that we will actually be able to see this implemented and supported in the state. The other thing that's happening is related to dual eligibles. As you might recall, about a year ago, we had started the discussion with the state about individuals that were both Medicaid and Medicare, and that they wanted initially to implement this dual eligibles proposal throughout the entire state of Michigan about how that population would be served across the spectrum, ensuring the coordination of care for those high-cost individuals. And the state had then changed their plan and only looked at several counties. So it's a pilot program that they're going to implement in 4 counties in the state of Michigan, and then look at expansion throughout the state. But one of the key things was that they had planned on implementation of that actually this year, spring of this year, and now they've delayed it until next July. So just wanted you to be aware of that. And that's it related to my update. So is there any questions of the board?
Board, are there any comments or questions? Commissioner Rice? No? I got it. Got it? Anyone else? All right, thank you, Mary Beth, for that information.
Yep.
Up next for our monthly report, we have the Health Department. Interim Director Steve Hall.
Morning. Don't have too much to add other than my written report. I just wanted to focus on a couple of things. One, the budget. We're still monitoring 2014 budgets at the state level. The Michigan Department of Community Health, which provides the bulk of our funding through the Essential Local Services grant for our mandated programs, it is completely tie-barred right now to the Medicaid expansion. So depending on what happens there, the Department of Community Health budget might get changed drastically. And just so that you know, to make it sound better, the new name for Medicaid expansion is Healthy Michigan Plan. So that's apparent. Healthy Michigan Plan, yes, that sounds better apparently than Medicaid expansion. There was a bill introduced on Friday from Representative Lori, so we're monitoring that. One thing that might be of note to you as well is currently for the Essential Local Services grant, there are placeholders in both the House and the Senate budgets for that particular category, which means we might actually be due for an increase, and we're hoping and kind of talking to state representatives on that. That line item had been cut $2.7 million since 2010, and so we're advocating for the $2.7 million to be restored. And again, that funds our 8 mandated programs. Other than that, all I really wanted to touch on, I believe I included the non-community evaluation of the program in environmental health. And I just wanted to thank Mary Farmer. She's our non-community coordinator in that. And if you looked at that report, it was excellent. We met all of the MPRs, but if you also looked at the graphs, you saw that we were better than the state average in every category that they looked at. So we've done a great job in that program. So that's it, unless you have questions.
Commissioners, any comments or questions? All right, thank you.
Thank you.
Up next, Marcy on Department of Aging.
I'll review the written report that you have in your board docs information, and then I brought a PowerPoint to talk about information that was presented to you Friday morning at the study session about 2014 proposed budget cuts. So with regard to the monthly report, Henrietta Nutrition Site is a site that over time there's fewer people attending that site. Right now there's 3 regulars who go there. It's a Monday, Wednesday, Friday site, maybe 5 people. I've talked with the Henrietta Township clerk and treasurer about having that site be what we call a food with friends, where instead of a hot meal that a site leader would serve, we would have our Meals on Wheels driver while they're out and about drop off cold meals, cold lunches, that then you don't have to keep it at a hot temperature and serve it by someone who's gone through food safe, that type of thing. So we're looking at that. There is an exercise group that meets there Monday, Wednesday, Friday. They're done at 10:30, so they're not very interested in waiting until noon to participate in the regular hot site, but we're hoping they'd be interested in taking that cold meal. It'd be 1/3 of, dietary requirements that they could take with them and have it for lunch or suppers. Again, our purpose is to get nutritious meals out to older adults. So we are having that conversation. Lori Carpenter, our nutrition services manager, will be meeting with that exercise class. So more information to come about the Henrietta Nutrition Site. And just a reminder, Grass Lake community asked us if we would do a food with friends, and right now there's a monthly group that meets the 3rd Thursday of the month, and we again drop off a cold meal that they have while they're congregating. That's the rule for Older Americans Act. They need to be congregating, and then we can provide a meal. Okay. Mentioned the financial scam seminar went real well on April 23rd. Friends of Jackson Seniors is a nonprofit 501c3 organization, and they have applied to the Weatherwax Foundation asking for funding to help pay for senior dental care for seniors who are moderate income and don't have dental insurance. It's a program we've done with Center for Family Health in the past, and Center for Family Health asked us to look into that again. So I haven't heard back from the Weatherwax Foundation yet whether or not it will be funded, but the $10,000 would be about for 3 years of services for senior dental care, and Center for Family Health would do the initial assessment and care plan, and then another dentist in the community would provide the services at a reduced rate. And a reminder, Senior Festival is coming up soon. It's on a Wednesday this year. It's May 22nd. And it's at Westwood Mall. We have 40-some exhibitors with a lot of information, and there's entertainment and lunch, cold lunch provided.
So just if you can stop by, it's from 10 o'clock to about 1:30. Any questions about the monthly report?
Board, any comments or questions? All right, thank you, Marcy.
Okay.
Continue.
Friday was the list of a variety of proposed cuts related to the 2014 budget. There were several departments. Department on Aging was one. This is the list that Adam had on his PowerPoint presentation, so I just wanted to explain a little more what's on that list. And to let you know, there's an aging leadership team. It's a part of the high-performance organization value that we have. So it's not just my decision. I have input from 7 other people on our aging leadership team. And we together came up with a list. Also, we consider the commissioner's prioritization of our budgets. And also, I did a prioritization of services with staff like our meal drivers, nutrition site leaders, home care workers, office staff, and also the Advisory Council on Aging. So they looked at priority of services. On the list of cuts, it talks about exercise class cuts. It's not eliminating the senior health promotion program. It's just we have cut down on the expenses by the way that we're providing the programs. We're paying individual leaders, exercise leaders who are have the certification to lead Tai Chi and yoga and another Arthritis Foundation class. So we're paying individual people to lead the classes rather than paying the health department's health educator 2 days a week for her time. So we have some savings there. We just some, again, miscellaneous cuts like no yellow pages ad, that kind of thing. Right now, we reimburse RSVP for bus ticket costs, half the cost for about 4 volunteers. They primarily live in adult foster care homes, and they come in and volunteer. So it would be not reimbursing for half the cost of those tickets. We have some savings, too, because Community Action Agency is totally coordinating the Volunteer Income Tax Assistance Program, where before we would have a temporary casual employee who would coordinate for that program for us, and now Community Action Agency is doing that. When senior millage passed, we started to pay for Lifeline services for older adults who, again, were limited income. Lifeline is where there's a call system that you have, that you wear it on your wrist or like a necklace, so that if you fall, you have a button you can push, and then an emergency contact person is contacted to come and check on you. So right now we have 15 seniors that we're paying for that service. Through attrition, we were cutting that back, but currently we have 15 people receiving that service. I just talked about Henrietta. To convert that with Food with Friends, what that means is laying off the casual site leader. We wouldn't be paying for a food license for that particular site, but we still would provide the food to the seniors who want that meal, either with Food with Friends, or we would drop off meals through the Meals on Wheels program. We would just consider that not grant funded. It would be county funded if they're not homebound, because with the grant you have to be homebound. But so we're getting food to people. I don't want you to think that's not the case. But to have a site leader there 3 days a week, that's what we're saying we're going to stop doing. And the township understands this, and I've talked with Commissioner Lechka about it too. The other information on the proposed cuts is reducing casual home care workers, and that would be for people who are wanting light house cleaning only. So the bathing assistants, we wouldn't cut back on that. We wouldn't cut back on the respite, which is someone to be in the home with the person who needs care so the caregiver can leave for 3 to 4 hours. But it's people, we do an assessment. We have to do an assessment initially in every 6 months. But there's a point system with that assessment that the Area Agency on Aging has. And so it would be people who have lower assessment points than that we would not do what we call homemaker only. We would cut back on those hours. And the last one, our department secretary is due to retire. She's in drop. She'll retire in about a year. And it would be reducing that position from full-time to part-time. In the last couple years, we've already reduced a clerical position in our department. We used to have a full-time account clerk who would assist in answering phones. That changed to part-time, and then just recently, we no longer have that position in our department. We're helping to fund a position that's in the finance department. So because of that, because we're getting shallow in handling calls coming into the department, it would mean any calls coming to the department going to voicemail about at 4 o'clock in the afternoon would be our plan. But in relation, connected to that, though, there's reductions, but we also have service needs. I just want you to be aware, we get a lot of requests, over 1,100 from October to December. 1,100 seniors are contacting us, asking about their Medicare Part D review. The Part D is the drug plan, and people need to review that every year because the plans will change. And we get a tremendous amount of calls, and we do have volunteers, but it's because of the situation, they're not there every day. They're there maybe one day a week. We have 2 part-time positions that have other jobs, but during this October through December, they only do Medicare, Medicaid assistance. It would be nice to have a casual person trained to do both outreach, the in-home assessments, and be trained in Medicare, Medicaid assistance. It's a 6-day training that the state provides. Again, it's just kind of, for me, it's on my radar. This is a tremendous service to our community. By having the help from Medicare, Medicaid Assistance Program, or MAP, it reduces seniors' cost for what they pay in health care plans. It's money in their pockets. So, again, I'm just keeping that in mind. It would be nice if we could have more support for that program. I've not heard about federal sequester cuts yet. I haven't heard yet from the Area Agency on Aging what those amounts will be, or whether they can replace any of the federal funds. And if they do, whether it be a short-term basis or ongoing basis. And that's about $56,000. So I have one other point about proposed cuts, but before I go, it's a facilities topic, so before I go into that information, do you have any questions about Department on Aging programs or budgets?
Commissioner Leitner?
I just have a question. I'm just curious. On the senior lifeline, do you only provide for 15 now, or how many do you provide for altogether?
15 right now. In the past, it was about double that. But through attrition, we've stopped adding new people.
Okay.
So
it's been a service you've kind of already been cutting
out.
Yeah, okay.
Because of cost. Yes. Yes, it's a program that's available. There's several companies that provide it, but we're helping 15 seniors by paying for it.
How much is it?
$20 a month for the company that we use. Yeah.
Do you see any?
We haven't looked at grants specific to, it's called Personal Emergency Response Systems. We have not looked at that, no. Some companies will give a discount. Okay, anything else? All departments are making suggestions, and I just want you to be aware, one of the suggestions is to eliminate an elevator for each building, so I just want to describe the Human Services building. And if this happens, you know, I understand we'll make provisions. But we prepare 1,200 meals a day. The food is brought in by truck to the delivery dock at our building. There's the main north-south kind of hallway or corridor in our building, and the kitchen's at the southern end of that hallway. So what happens is in the lower level, this is the walk-in freezer, and then we have dry storage. This cart has boxes for 2 components of a 5-component meal, and we do 2 meals a day. So this is a portion of what needs to be taken upstairs. So there's maybe 5 to 10 trips like this up from the ground level to the first floor. This is the current elevator we're using. It's not the public elevator. This one's right across the hall from our storage, and then the first floor, it's across the hall from the kitchen. So if that elevator was not available, then our stock person would go down this hallway through those doors, and on the other side of those doors is the public elevator. That's the public elevator. And so then when you get to the first floor, our floor, then he would turn right and go back down the hall again to the kitchen, so through that doorway. And it's the stock person who's been 30 hours a week, and because of healthcare reform and the reduction in part-time positions, his hours will go to 29 hours a week. So this will add time to his day to haul the stuff, and it probably won't be very nice to basically bang up the public elevator. But, you know, if we have to do that, I understand. I'm just letting you know that's how it would affect our doing operations, our performing operations. So, any questions?
Thank you for that information.
I understand. I understand. You've got a lot to sift through. Yeah.
Thank you. Thank you, everybody. I believe Toby sent in a separate report. Oh, sorry, I'm not that tall. Yeah. I'm here to report on the Step Forward of Michigan program. I am the program operations manager over our housing department, and we are a HUD and MSHDA approved housing counseling agency. And one of the things we do is foreclosure prevention. And the state of Michigan received, I think you all have that, $498.6 billion from TARP money. It came to the U.S. Department of Treasury into our state, and the state created a program called Step Forward Michigan. And that program has 4 components, but it's to help homeowners who are facing losing their home to foreclosure. And the 4 components of that program are unemployment subsidy. So if somebody is receiving state of Michigan unemployment, if they're receiving it or their spouse is receiving it, they could get up to $1,000 towards their mortgage payment. The state would pay half of their mortgage payment up to $1,000. They would also bring them current if they had fallen behind, as long as the total amount doesn't exceed $30,000. Then that's the unemployment subsidy. Then they also have a rescue fund, loan rescue fund, so if they're behind on their mortgage, they would pay up to $30,000 to bring them current on their mortgage. They also have a principal curtailment where the state would put in $10,000 and the lender would put in $10,000 in order to reduce the principal in order to make a payment more sustainable. However, a lot of lenders don't participate in that one because they don't want to pay the $10,000, or the investor doesn't participate. As an example, Fannie Mae and Freddie Mac, they will not reduce principal at all, and therefore they don't participate in that program. So that eliminates a lot of homeowners that are eligible because the lenders won't participate if the investors aren't going to help them out. So that one's not so popular. That one's more with your local banks. They are the ones who are working with that program with the state. Then you have the modification program, and the modification program, and this is a really push this year, the state's going to push this piece. It's for homeowners who are becoming delinquent or are already delinquent, and it's where they would give $30,000 to reduce the principal. The state would do it, but the lender would have to do a modification. So they would re-amortize it, get the payment down to make it affordable for the homeowner. So it's a way to not do the principal curtailment, but get the payment lower, and it really will help homeowners who are underwater and can't refinance. This is a way they can get a lower payment. In January 15th of 2013, the state added to their loan rescue funds the tax foreclosure rescue fund piece, and that's what I want to talk about today. It really has helped our county. Over 80 homeowners have applied for this tax rescue fund, and it's where the state would pay up to $30,000 to bring homeowners to pay their property taxes so they would avoid foreclosure. And in Jackson County, there's a lot of homeowners who don't have a mortgage, so they weren't eligible prior to January 15th because the loan rescue funds were only for mortgages. Now it's for mortgages and or property taxes. So it really helped these homeowners. So we partnered with Jackson County, the Treasurer's Office, and we worked out where we did a lot of outreach, as well as anybody who called the County Treasurer's Office and then called our office by April 1st, all tax foreclosures were put on, for that homeowner was put on hold. So we saw 56. And so Karen from the county treasurer, she agreed to put all those tax foreclosures on hold as long as they had an appointment at our office by April 12th. And so we helped them apply for the Step Forward of Michigan program. And then there was 24 on their own, so 80 of them were on hold. And we saw every single one of those 56, and they had an appointment and they've applied. I tried to get an update of how many that the state has agreed to fund, because right now they're just still in the application process, but they looked good, and as long as the homeowner, as long as it's their primary residence, and as long as they don't have 3 to 6 months worth of like a mortgage payment in their savings or checking account, or it can't be a land contract, and it's sustainable for that homeowner, then the state is really looking at funding. We can't guarantee that they're going to fund the homeowners, but all the ones that we submitted, it looked like they would be eligible. They look like a good candidate. So we're still waiting. I called this morning before I came just to see if I could get more of an update, but they update the Monday on the week of the 15th every month, and so it's going out today, but they hadn't generated that report. So tomorrow I could give that to you, but not today. So right now I only have what I sent you. I think there's 4 that have been approved, but more will come. They have to prioritize. Right now there's a lot of sheriff sales, and so they had to prioritize to get those homeowners taken care of first, and then they're working on all the other ones. And the state does say that these funds should be available through 2014. So it will help next year as well. These are just 2010 too. So next year, and our hopes at Community Action Agency is to not only help them apply for the Step Forward, but to also educate them on financial management and help them budget and set up their own escrow so that they don't get into this situation again. So you have the 2011 that are going to be coming up that we're working with those homeowners already right now. Are there any questions about the program?
How you doing?
Good, how are you?
Fine, thank you. I'm sure Toby's glad that she's not standing there right now. I'm just kidding. I would ask you what your thoughts were about Fannie Mae and Freddie Mac, but I won't do that, okay? I have my own thoughts. The Step Forward, just to throw it out to you, we did get a report from the treasurer, and it's up to 96 now.
Oh, wow.
So just to throw that out to you.
Oh, wow.
And second thing is very good report. I do want to ask, so on the amortization schedule that people can use when they do modifications, what are some of the type of interest rates are they getting, or what would potentially be the lowest interest rate, the amount of years that they would be able to modify?
Well, that will be up to the lender and the investor. So like if it is a Fannie Mae or Freddie Mac, they could go out to 40 years to re-amortize. Yeah, and it will depend on the lender and investor on how low the interest rate can go. So it depends on which program that they're in, under which modification that they're going to get on how low the interest rate. It could go as low as 2%. It could get stretched out to 40 years. It could be as low as what the current market rate is, and so that could be 3.5. It just depends on the investor and the lender.
All right, thank you.
Thank you. Oh, thank you.
Is that on? They are included, correct. All right. Up next on our agenda is an item that does need to go to the full board. We need to approve the lease termination agreement with Lifespan and authorize the chairman of our county board to execute the lease termination. So is there any information that the administrator's office would like to offer? Okay. Comments, questions, concerns?
I'll move to the full board approval of the lease agreement authorizing the chair to execute the termination.
It's been motioned by Commissioner Rice, supported by Commissioner Plachek, to move that to the full board. All in favor, say aye. Aye. All opposed? Next up, under other business, we have the claims from April. Yep, everyone has seen them and signed them, yes. So we're okay. Looking for a motion? Commissioner Rice is going to pay the bills this month, and Commissioner Plachek is going to back her up. All in favor, say aye. Oh, sorry. All right, all in favor, say aye. Aye. All right. In our board packet under other minutes, we have 2 other committees that have submitted minutes. We have our June reporting schedule for Department on Aging, Health Department, Lifeways, Department of Human Services, Medical Care Facility, Veterans Affairs, and Medical Examiner. Now we're up to public comment again. Is there any public comment? Committee member comment? Commissioner Duckham, you've been awful quiet down there. That makes me nervous. All right, just checking. I believe we'll call to adjourn to the call of the chair at 10:36.